guys may take advantage of this statement, but the penis is a use it or lose it organ. Okay, so when the penis goes in the garage for an extended amount of time, meaning no erections, like no sex, no physiological erections that normally occur in the middle of the night. Now, why would that happen? You just had a prostate surgery, and you have stunned the nerves, you have significant diabetes. You've basically just gotten to the point where the erections aren't happening very often. We know that men who don't get erections commonly get penile shortening, right? So you lose length of the penis.
Everybody wants to know how rapid and how much.
Yeah, so on average, if you've got a consistent lack of erections for 3 months, you lose 1 to 2 centimeters of length, which is a ½ inch to an inch in length. And every millimeter guys fight for, right? So
that's a lot.
It's significant. Yeah, it's significant. Actually, earlier in my career, as I was a urologist at the VA and we were doing prostatectomy surgeons, the patients would say after the prostate surgery, say, "Doc, I think my penis is shorter." I'm like, no, you're just a little bit fatter. It's hidden more, and then they kept saying it. And that was like one of the first studies I ever did. And we actually measured, and it's true. Guys lost penile length. The good news is that if you exercise the penis with a vacuum erection device, you can regain that length back. So it's not about like physically shortening the penis. It's about having scar tissue in the penis. And if you have a uniform scar with erection, the penis looks shorter. If you have a non-uniform scar, you get this curvature, right? And that's Peyronie's disease. Peyronie's disease is loss of elasticity on one side or one part of the penis. And like a balloon, if you put a piece of tape on a balloon, you inflate it, the balloon's going to curve where that piece of tape is. That's what Peyronie's disease is. And again, that's something that's very common in men, about 10% of men above age 50.
10% of men above age 50. You do support the use of, what do you call it? The penile enhancement device? What are they?
Yes, a vacuum erection device.
A vacuum erection device.